Welcome to our series on global challenges, pandemic and the world order. My name is Nicole Bibbins-Sadaka, and I'm the Deputy Director of the Master of Science in Foreign Service program at Georgetown University. Our topic today is fragile states and how the pandemic has impacted those states that well before the pandemic were fragile, facing weak governance, poverty, disease, violence, and other significant challenges. We will have our faculty member, Dr. Shanta Devarajan, who's the Chair of International Development at the Masters of Science in Foreign Service program, a former Senior Director for Development Economics and Acting Chief Economist at the World Bank. He will be interviewing two different experts in this field, Dr. Roger Kamba, the coordinator of the Democratic Republic of Congo's COVID response for the President's Office, and Franck Bousquet, the Senior Director of the World Bank's Fragility, Conflict, and Violence Group. I hope you enjoy our conversation.
Dr. Roger Kamba, welcome. And if you could please introduce yourself and just say what you do in the Democratic Republic of Congo.
Yeah, I'm Dr. Roger Kamba, and I'm advisor to the President for UHC, Universal Health Coverage, and I'm the coordinator of the task force of the President for fighting the COVID-19.
I see. Okay, so can we talk about COVID and DRC? The question is, what have been the big health and economic impacts of COVID on the Democratic Republic of Congo?
I think, thank you for the question. I think that the big impact is social impact and economic impact, because according to the deaths, we just had, until now, we had 200 deaths. So it is not a big impact on the health system. But according to the health system, it is also a big impact because many hospitals are empty now, because everyone is
afraid.
People left the hospital because they were afraid of COVID. So we had a response to the COVID, but we lost people who had other diseases because they were afraid of COVID. So we didn't communicate very well, and this is a big impact on the health system. But I think that the biggest impact is on social and economic system, because our country is very poor, and as we were strong in the capital, so that was a very big impact on the economic system. And people are poorest, and they're more fragile, and people died of other diseases because of this COVID-19.
I see. Now, if I could just mention that DR Congo has faced other pandemics, such as Ebola,
yes,
and HIV/AIDS a little bit.
Yes.
So how does this compare with Ebola in particular, because that was quite recent?
Oh, I think there is a big difference, because Ebola was just located in a part of the country. It was located of the country, and it was a very small part of the country, which was where the impact was strong. And the Ebola, secondly, the Ebola stayed on a health part of the system. So it was located in just a part of the country, and it was just a health problem. It was not an economic problem. It was not a social problem. It was a social problem for a very small part of the country, but all the country was protected. This is the big difference between Ebola and the COVID. And the second one, Ebola was accepted as a disease. People were afraid by Ebola because it was very impressive. People were bleeding, people were having diarrhea, and it was very, very impressive. So people were afraid of Ebola. But for COVID, people are not afraid of that. So it is larger, and people are not afraid. So the impact is more important with COVID.
Okay, let's discuss that. If people are not afraid, then what are they doing, and what should the government be doing to maybe make them more afraid so that they will avoid getting the disease?
We don't know if we have to make them more afraid, but what the people are saying, they don't see people dying. They would like to see people dying. And if so, they can be afraid. But I don't know that is the solution. But what the government can do, but first of all, I come back to people. They are not afraid of COVID, but they don't go to the hospital. So somewhere they are afraid. They're
a little afraid, yes. That's interesting.
But they don't take measures to protect themselves. This is very, very, it's kind of, we are afraid, but we are not so afraid. This is the first thing. But according to the government, I think that the lack we had is the lack of communication. We didn't explain, we didn't adapt the communication to our local people. We did just try to say, okay, you have to wear a mask to clean your hands. So this is something which is said everywhere in the world. We didn't adapt it to our people. So they didn't be afraid because they didn't see many people dying. And now it is a very, very challenge for us because we stopped the lockdown and we know that people are not afraid and they don't go to the hospital. So it's challenging.
That's very interesting. But how did they react to the lockdown? Because if they weren't afraid and they didn't see people dying, then being told you cannot leave your house, you cannot move around, must have created some kind of resentment.
This is another thing. The lockdown was just located in the center, in the downtown, and downtown is considered as rich people living in the downtown. So people in their mind, COVID is a disease for rich people.
I see.
So they couldn't come to the downtown where every activities were. And this is just the thing they didn't want. This is the thing that
it didn't disturb them.
This is the thing that disturbed them, the fact that they didn't come to the downtown. But otherwise, they just continued their life as they did before. So it's just kind of contrast. Mm-hmm. This lockdown is not for us because we are not sick, but it is for us because we cannot go to the downtown. And now, as we stop the lockdown, they come back and they say, oh, okay, it was not a disease for us, it was a disease for rich people. And we don't see where people are dying, so what's happening? We are just free. We can do what you want. But if you tell them, okay, but if you have some symptoms, please go to the hospital and say, oh, no, I cannot go there because I'll be sick there. Mm-hmm. So it's disturbing for us.
So the concern is that even though you have very few deaths, it's 800 deaths, that it's still possible that the epidemic could get worse in DR Congo if people still don't believe that they need to wear masks and maintain social.
I think that the epidemic can be worse. I think that. But we just note that in Africa and in Congo particularly, the epidemic is not not killing people as it did in Europe and in America. So we don't know because our lockdown was not in all the country. It was just for the downtown of Kinshasa. But the number of people who are dying is still not so high. So maybe the epidemic will be worse. The number of people will be contaminated will be worse, but I'm not sure that we will have so much more people dying because people are very young. And we think that as they didn't take any measures, I think that many of them are contaminated already. Mm-hmm. And it doesn't change anything for them.
I mean, you're talking about deaths in particular, but what about infection rates? I mean, are you doing testing to get a sense of whether these young people are actually getting infected?
This is the big concern of poor countries and for DRC. We didn't do many tests. We are doing about 600 to 800 tests per day. So it's not very, very high. But even so, we see that people who are positive are becoming less and less, according to the same number of tests we are doing. So we have the impression that the epidemic is going down and down. But we just stopped the lockdown, so we don't know what will happen.
Right.
But even if people are more contaminated, we just note that we don't have so many people dying. Yes. So maybe it will not change something, maybe it will be worse, but we are waiting and see what will happen.
And have you noticed a change in the other diseases? You know, if people are afraid to go to the hospital, they might be dying of other things if they don't get the treatment. Have you noticed any changes in other maladies?
Yeah, but what we did as task force of the president, we went to see in each hospital how many people died. Even if they were not tested positive for COVID. Mm-hmm. And there we see that there are many people who had died, 2,000 people more than the same period of the 2019, from January to May. So that means that according to other pathologies, there are some concerns, but we cannot be concerned right now.
Yeah, and I mean, DR Congo is a poor country, as you said, and there are people dying all the time, especially high levels of child mortality, children and things like malaria and other diseases. So it's hard to isolate the impact of COVID from all other problems.
Yes. Since we don't test enough, we cannot isolate the people who are dying from COVID to other diseases.
Now, you mentioned the things that the government has done, things like the lockdown and some testing and so on. What has been the role of other actors, particularly the private sector, the civil society, and the donors in helping battle the pandemic?
Yeah, I think that the social workers, the social part of the country, I think was very, very involved because many people who were hospitalized couldn't eat enough. Civil society was very, very involved in bringing foods to people who were sick because the hospital could not give them food. So this is a kind of what civil society could do. and the private society was very involved as donors. They gave money, they gave protective stuff for hospital workers, and I think that all the society was involved. And many times it was not because of the government decided something, it was just because people were involved by themselves.
Because they're always helping each other, even in normal times.
Yes.
But now you mentioned that one of the problems was the lack of communication by the government.
Yes.
Get the messages across. Is there any way that you could have used civil society to make those communications? You know, one thing is civil society providing food and help, but the other is as a messenger for conveying the messages.
That we did some mistakes, and one of the mistakes was we didn't give civil society, we didn't give them the opportunity to be the messengers. It was a message coming from the high, and people couldn't accept that message because, first of all, they considered the disease as a disease for rich people. If rich people come and tell them, pay attention for that and for that, they don't believe. And this is the mistake we did, and we have to adapt it now.
So what are you doing now with civil society?
So what we are trying to do now is to convince people in the neighbors, because in each
district, each district.
In each district, there is people who are recognized as their leaders. So we are going to touch all those local leaders and to get them involved in the response as messengers to improve the communication.
Excellent, excellent. Now, you're also in charge of universal health care in DR Congo.
Yes.
So are there any lessons from the COVID experience that will have some long-term effect on the health system in Congo?
The first lesson we learned is that now everyone has in his mind clearly that the health system must be improved. Now it's clear for everyone. It was not so clear 3 months ago. Now this is the first thing which is important. The second one, policymakers now know that they must put money for health. It was not clear 3 or 4 months ago. This is the first line of information we learned. The second one is the necessity of taking care of people as a protective system, because people were paying by themselves. So right now we said, okay, for COVID, no one can pay. But if no one is paying, we have to try to find money and to put the money at the right place. So to involve the system is the second thing we learned in this pandemic. The third one is that, first of all, we're thinking about universal health coverage just as primary care. But now we know that we have also to improve the secondary and tertiary care. Because if someone is needing oxygen, we cannot say, oh, by just giving vaccination, by just improving child and the maternal system. We all have to improve the system.
Okay, so that's on the health side, which sounds like there's going to be a bigger effort
Yes.
more spending on health, primary to tertiary to and also broader coverage. The question is, what about the rest of the economy? What have we learned about the management of the rest of the economy? Because these resources come from somewhere else, and then how are we going to manage the rest of the economy?
Yeah. Another thing we learned is that we have to product by ourselves some stuff, some medications, some protective equipment, because when all the borders were closed, it was a challenging problem for us, how to get medication, how to get medicines. So economic, if we can speak about the economy, we can say, okay, we have to improve small industries to product basic stuff, basic medicine, basic equipment, protective equipment, basic medical equipment. And we saw that our universities are now, our researchers are now involved in searching local solution. This is the first thing, if you can say, on economic board. And another one is to produce food as a big concern for all the nation. And so agriculture must be improved because of a big concern during this pandemic. And another one is to use better our money, because we are our economy is importing everything. This is normal. And what we saw that, because I asked to see what are the products you are importing as the more important. We see that we are importing clothes. So we have to change the stuff we are importing and to put the priorities on other things. For example, on industries, factories. So we have to change our way of importing.
Well, that's actually quite controversial because, as you may know, that's how Africa used to be in the 1960s and 70s. They were importing, they were not importing, they were actually trying to produce domestically. But it turned out that that was much more expensive than importing. I mean, the clothes, for instance, right? I mean, cheaper to buy clothes from China or Bangladesh than to produce it domestically.
Yes.
Costs of production are high, and people are able to get clothes. Now, there's no question, you're right that the result of the pandemic, there was an interruption in trade, but it's only short. I think trade is now beginning to open up again. So the question is, do you want to, based on that one incident, when there was this interruption of trade, do you want to switch the whole strategy towards producing domestically? Because producing domestically has a cost. And a poor country like DR Congo may not be able to afford that cost.
I'm sure that it has a cost to produce locally, it has a cost. But we notice that even our food, we import it. So we have to upgrade our laws to make sure that we can protect some kind of product that we have to get by ourselves. So even if it has a cost, but we think that this cost must be paid by us. Because we have many epidemics that come and come again. So if we had another one, we don't have to stay in the same situation as we are now.
So it's like an insurance. It's trying to have protection. Okay.
Yes.
Okay, finally, let's step back a minute. If you were to project how DR Congo look 5 years from now, assuming the epidemic has come and gone, what would be the big changes you would see in 5 years that you don't have today, both on the health side and on the overall economy?
I think that at the health side, the big change will be the universal health coverage. That will be the big change. Because right now, people are paying fees for health. They are paying about half of fees are paid by families. Mm-hmm. And the other half is paid by donors from European, America country. So it's not, we cannot be confident with that kind of situation. So I think that the big change we'll have in the 5 years will be the universal health coverage at the health side. At the economic side, I think that we have to improve local industries to protect from interruption of product can need if we have another big challenges with it. So I think that this is the two arms we can have in 5 years.
And on the universal health coverage, you think it's because there's this political support now as a result of COVID? People are realizing that they need to invest in UHC. Is that as you mentioned earlier?
Yes, and it's also because of it will improve our economy. Because as families are paying all their fees, they cannot put money beside. So as family are paying the fees, they don't go to the hospital if they don't have. So they are getting sick, and they don't for that. So I think that at the economic side, we have to get people who are in better health.
No, but that's, I'm just trying to understand what's changed, because that's been the case for a long time, that families have been paying out-of-pocket expenses for decades. And it has been hurting the rest of the economy, as you said, because they can't have the to educate the children or improve their house. So the question is, why does the COVID epidemic, why will it change that situation?
This is what I said before, is because political makers are now aware, and now I think the people now know that they have to put money on health system.
I see. So it is bringing the attention of the politicians.
Yes. Yes.
Okay. That's very, very, very useful and very interesting, Dr. Kamba. So let me thank you and Madame Therese for this very, very...
Thank you, and I apologize for my English.
Oh, it's perfect. I think the students will find this...
If it was in French, maybe it would be better.
But I thank you very much for this discussion, but also for what you're doing at DR Congo. This is extremely important work that you're doing.
Thank you very much.
Okay, goodbye.
Okay, goodbye.
Bonne journée.
Bonne journée à vous.
Franck Bousquet, welcome to the discussion about fragile states and COVID-19. Let me first ask you, Franck, to introduce yourself and tell us what your job is at the moment.
So Shanta, it's a pleasure to be discussing with you, especially, and with trying to share a little bit our experience at the World Bank with SFS students. I am the senior director at the World Bank in charge of fragility, conflict, violence, and forced displacement. So basically, we are supporting all our colleagues across the world, especially those involved in fragile settings, in situation of conflict, in situation of refugees, to really move on the development agenda in those places. Very challenging, that requires a new approach. We just released a new strategy in February that tried to see how we can adapt our DNA to this very specific environment.
Thanks. And it's a very good strategy, I might add. So let me start, Franck, talking about COVID, because you wrote an op-ed, a blog post with a colleague from the UN, where you suggested, this was back in April, I think, that you suggested that the spread of COVID might be more serious in fragile countries than otherwise, and calling for a greater mobilization. Now, if you look back in the last 3 months with hindsight, my impression is that there isn't a single fragile state so far where there's been a surge in the COVID pandemic. And indeed, the countries that people talk about as having very serious outbreaks, like the US, UK, India, Brazil, South Africa, Indonesia, are the countries that we never considered as fragile states. So what's going on here?
Well, I think there are a few points. First, we need to realize and recognize that there is still a lot that we don't know about the impact of COVID, not only in fragile countries, but also in other countries. So I think we need to put everything in perspective. It would be interesting to watch this video in 2, 3, 4 years. What I would like to mention is just a few points, Shanta. First, very important to look at the growth rates. In fragile and conflict-affected countries, there has been actually today about 450,000 cases and about 9,000 deaths. But we have seen really rapid increase in these numbers. So I was just for this interview looking at my numbers, and just over the past month, between June 22nd and July 22nd, the number of COVID cases in those countries that are in fragile situations has actually increased by 43.5%. So, you know, WHO has warned us that while it took 98 days for COVID-19 case in Africa to reach the 100,000 mark, it only took 18 days for the number to double to 200,000. So my point here is to say, yes, the numbers are low, and I will come back to it. There may be some explanations, but watch out, the increase in the growth rates are quite high. Now, coming back at those numbers, we know that all those countries are facing significant challenge in terms of testing and contact tracing. Very challenging to do it in a fragile context, in a situation of conflict. Very difficult for those countries, by the way, also to enforce social distancing measures, for instance, in slums, in refugee camp, and in situation of active conflicts. So, you know, when we don't have data, obviously we are not going to report a lot about it, but we need to understand also that those countries have been, over the past few years, investing very little in health systems, and they don't have necessarily the capacity to report on all those cases. But I would like to mention, maybe, if I may, Shanta, 2 other points that are very much linked about the impact of COVID-19 in those countries that are already impacted by fragility, conflict, and violence. I think it's important to go beyond the number of death case or confirmed case of COVID-19 at different levels. So focusing more on the impact, for instance, that COVID-19 has on the overall human development aspects, on the other disease that unfortunately will not have the resource to be dealt with. COVID-19 is challenging many immunization programs for other diseases. When you took, for instance, measles, but for instance, in Yemen, which has a high mortality rate for COVID, it has also experienced cholera outbreak last year. And WHO recently indicated that malaria death could actually double this year. So we really have to understand that the impact in those countries is not necessarily to be measured in number of deaths or cases, but more about the secondary impact. Secondary impact within the health systems that are significant. This is where I am especially worried for those countries, but also impact on the economic front, for instance. As you may have seen from different articles and projections by the World Bank, many of those countries are going to have biggest recession for the past 5 decades. They are highly depending on remittances. And guess what? Many economic migrants working in the US, in Europe, are out of job. They do not have the capacity anymore to bring back money home. And this is a major resource of revenue for those countries. Remittances represented last year even more resource in terms of ODA than the classic official aid. It was about $51.6 billion to fragile countries. So this is a major impact on those countries. And again, we should not be looking purely at the number of deaths of COVID cases, but more about the secondary impact. The last secondary impact, which is, I believe, extremely important, we may have the opportunity to talk more about it, is obviously the fact that COVID-19 is exacerbating, in many cases, the drivers of fragility. And therefore, there is a major risk of creating more instability in many countries.
Yeah, that's very good. By the way, just to reinforce one thing you said, Dr. Kamba in Congo pointed out that in DRC, one of the things that happened is that patients who were in the hospital for other reasons, they immediately left the hospital when COVID struck because they were afraid they were going to get COVID. And now those people are actually out there in their homes, not getting the care and maybe even spreading other diseases. This kind of situation.
Yep, yep.
But so you listed all the things that for which we should be worried and we should be careful. But are there some other aspects of fragile states that make them maybe a little bit more robust to the pandemic, or anything in the state of these countries?
So, you know, it's interesting because I think, and that's the point of our new strategy, it's not only looking at drivers of fragility, but also what are the source of resilience, and which is a little bit linked with your question, Shanta, on which we need to build on. Very often in the past, we have focused a lot on all the issues that those countries are facing: corruption, elite captures, inequalities, but not necessarily trying to see, fine, how can they build from there? And in fact, a good example is that while the challenge in those contexts are significant, those countries also have important source of resilience that can actually offer lessons learned to other countries, even those that are not necessarily fragile. So many of those countries, they have already gone through similar crises. Let's not forget that we had the West Africa Ebola crisis, and we have many good examples from Liberia, Sierra Leone, but also, you know, experience of major crises of addressing dual shocks of climate change and FCV in the Pacific, also rebuilding after conflict like in Central African Republic. So many of those countries are actually facing not the first crisis, but crisis number 2, number 3, number 4. So the whole point about trying to do things differently, engaging communities, trying to ensure that we can take advantage of a crisis to build back better, you can see it in some countries. It's too early to say, and I think we'll judge that in a few years. But obviously, those countries have had experience managing those crises. Let's not forget that if they are in fragile situations, because they have not a lot of capacity to manage shocks from inside their communities, but shocks from outside. This is also a little bit the definition of fragility. And therefore, yes, there are some source of resilience. We are trying, I have to say, over the past few months, to support countries in leveraging those sources of resilience. For instance, as part of their response, many of those countries have been trying to manage and address some existing grievances from different communities by providing equipment, ventilators, and services to some communities that already were not feeling the state. So you have seen in some countries actually good sign of building on the resilience, building back better, and trying to take advantage of a huge crisis to address some grievances and some issue. The same, we are seeing government, Shanta, that are also increasing the use of digital technology to provide services to citizens. Obviously, in terms of e-learning, many governments, Mali, but others, are providing more and more lessons to students through TV channels and internet. And this is fantastic to see that, because we know there is a gap in technology and internet. And therefore, we also see in terms of social protection, but also in terms of health, provision of medicine through drones, that some countries, again, are trying to leverage this crisis, quote unquote, to leapfrog and take advantage to build back better.
Yeah, no, I was actually thinking about something simpler, which is that the fragile states are also less integrated in the global economy. And therefore, there'll be less traffic, and so less chance of getting contagion from other, there are fewer tourists, for instance, or fewer traders coming through.
So it may be the case. We some also discuss the fact that the population is younger, and therefore, but I don't want to go too much into that, because I do think that it's, as I said, humility is important, and we need to judge in 5-10 years. Even in, I would say, developed countries, we start to realize that the counting has not necessarily been very realistic, and we start to look at the number of cases that may be underrepresented. So I think, yes, it could be the age of the population, it could be the lack of interaction with other countries, but again, the capacity to trace are so limited that it's way too early to judge. But that's yeah.
Nevertheless, the World Bank has moved quite a lot of money to developing countries in general, but in particular in fragile states, including about a third, I think, has gone to fragile states. That's what you said in a subsequent blog. But given the problems, as you stated, in these countries, how can you be sure that that money will actually go towards solving the problems that caused by COVID? And I'm particularly interested in what you think about, since the first round of that money went for the health systems, which it makes sense because that's the problem. But at the same time, the health systems of these countries, as you mentioned, are particularly weak and prone to corruption.
So I think it's important aspects. I mean, the first bucket that you point out to is all the corruption and the risk of fraud, which are obviously much higher in those environments that are marked by instability, insecurity, or low capacity. So we know it. Even with or without COVID, there is definitely higher risk, including from the World Bank, from bilateral actors, to ensure that the funds will be used for the appropriate purpose. On that, actually, we have a few mitigation measures, as you may recall from your time at the bank. First, we are really looking at the audits, supervision methods, ensuring that financial management procurement will be adapted to this type of low capacity environment. So instead of doing one audit every 6 months, we're actually going to do 2 or 3 audits. We are going to ensure that we are going to leverage ICT supervision tools so that when you don't have the feet on the ground, you can have eyes on the ground. We are scaling up in many countries the use of geo-enabling services, the capacity to track the use of funds so that we not only know that the school has been built, but that the teacher is going there. The whole point about building citizen engagement, grievance redressal mechanism, social accountability. This is not just for the paper. This is happening in reality on the ground and allows us every 2-3 months, and I would say even allow government, it's even more important, to ensure that the money is actually being used by the right people. So those mechanisms, I have to say, we are using them much more in this type of settings because we know that the risk is much higher. Second point, also, it's about the type of programs that needs to be put in place. Obviously, there are other ways to address this risk is to make sure that the assistance for the COVID-19 response is transparent and gets more directly to the people who need it most: women, children, healthcare workers. And the best way to look at it is also the type of programs, type CDD, community-driven development programs, type of social safety nets that do not have necessarily to transit through many layers and that can, in some case, build on an existing systems that has already been tested. So I think, I have to say there is no one size fits all. It's very important to look at the capacity of the country. We try not to create some parallel system that will do, at the end of the day, the opposite of what we're trying to achieve, is to actually to more and more build systems that are accountable from the government to its citizens. At the same time, we need sometimes to add some ring fence mechanism because we are using public money, and it's very important sometimes to use a PIU, project implementation unit, even if it's not ideal, but at least to make sure that the money will not be leaked to the proportion that you mentioned. Different ways. I'm happy to share with you some mechanism also that we are scaling up in Afghanistan, for instance, under the Anti-Corruption and Result Monitoring Action Plan, ACREMAP. It's really a new mechanism that we are trying to scale up in many other settings to ensure that we can enhance the value of money of bank finance operation, where again, there is more focus on corruption in a proactive manner. So when you do an audit, very often it's too late. So how can we build in those mechanisms during the supervision, and how can we make sure that it's not only the bank doing it, but it's also the government, which is also very important.
But have you thought about using mechanisms that go around government? Such as, I'm thinking of what we did in Yemen many years ago, where there was no government and they were still able to move resources working through NGOs directly to the households. And given the emergency that we are in with COVID, is there any possibility of doing that?
So we are still doing it actually in Yemen. We have been responding through a grant, I will come back to it, in Yemen with the UN agencies. The bank does not have also feet on the ground. So this is our only way to ensure that money will be able to be received by the people at the most need. I would like to say we have a program of about $1.7 billion. And since your departure at the bank, we have still relied on many UN agencies because they are present. This is the biggest humanitarian crisis, but I would say it goes beyond Yemen. We are working with the Red Cross. We are working with other NGOs. We are also leveraging third-party monitoring, which is extremely important. We just did a review of all the third-party monitoring at the bank. The main one, very well known, is in Afghanistan, but we use it more and more in other situations that can involve NGO and other companies to provide additional, I would say, mechanism that allow to ensure that there will not be any leakage in the system. But you know, at the end of the day, when the risks are high, you also have to look at the cost of inaction, if I may say. Obviously, the risks are high. You need to create mitigation measures, but the cost of inaction is even higher in those settings. And that's basically one of the key principles of the new FCV strategy.
Good. Now, as you said, even if all of this money goes to the purposes to which it was intended, and most of it is so far going to the health sector, it still doesn't come close to the resources needed by these countries, particularly, as you mentioned earlier, because if there's a lockdown, curfew, a shutdown, as well as the collapse in commodity prices, remittances, and so on, the resource needs are going to be much, much bigger than what the World Bank is able to provide. So what is the World Bank doing to help these countries access the kinds of resources at the scale to which they are really needed?
So, I mean, there are a few points, if I may, to respond to these good questions. First, on our end, just to get the number straight, we will be providing up to $160 billion in financing over the next 15 months. And that will be, by the way, not only on the health, but also looking at the economic and social shocks that those countries are facing. And this includes $50 billion of concessional financing from IDA, the International Development Association, the fund for the poorest countries, with built-in debt relief for countries at risk of debt distress. So I think it's very important to look at this. And as you are completely right, nearly 1/3 of the total projects are actually in fragile and conflict-affected situations. So we have many programs in Afghanistan, in Chad, in Haiti, in Niger, in Burkina Faso, in Papua New Guinea, because at the end of the day, this is where the poorest of the world are living. Second point I would like to mention is that in our intervention, we are trying to use some instruments that we call multi-phase programmatic approach that allow other partners to provide parallel financing. And I think this is very important to avoid suddenly that many donors are coming with their own system, many programs that will be actually representing more a burden than anything else for the government. So we are trying to design projects that allows not only for IDA or IBRD financing, but that allows as well all the partners to chime in. And that has already been used in some of those countries. I think the last 2 points I would like to mention, Shanta, is this notion of partnership. Very important, not only to leverage more financing, but also in those FCV settings to make sure that the financing will go where it's needed. You were mentioning Yemen. Without the UN, we will not be able to provide any financing in Yemen today. And that's the same in many other countries, in South Sudan, in many parts of Sahel, where basically today the situation is even worse than it was 1 or 2 years ago, because we don't have the capacity to be on the ground, government either, and many bilateral either. So therefore, it's very important to try to see how we can leverage some of the existing organizations, sometimes local NGO, not even international NGO, but also sometimes UN agencies that have the feet on the ground and therefore that are going to allow us to ensure that the money will go to the lagging regions, to the poorest communities that needs this funding. And therefore, again, this notion of partnership, I would like to take advantage of your questions to emphasize how important it is, not only in terms of leveraging the financing, but in terms of making sure that the money will be going to the most fragile settings. And we have a number of partnership with the UN. We are mentioning South Sudan, but also in Asia, in Papua New Guinea, in South Sudan with UNOPS, with WFP, WHO. I mean, what I would like also to mention, Shanta, is that we are working closely, as you know, with the IMF. And we have also urged bilateral creditors to offer debt service suspension to IDA countries, and basically creating space. So in addition to our own funding, the 160 billion that I mentioned, we are also looking at creating space, giving poor countries more financial resource to respond to the COVID-19 pandemic and finance critical emergency response. So this is another aspect that I would like to mention that goes way beyond our own financing, but that is extremely important for those countries.
Yeah, but everything you've talked about so far revolves around official sources of financing, public sources of financing. I was thinking of what about the private capital market? I mean, there's a lot of liquidity out there. Interest rates are at an all-time low, if not negative, and these countries need money. The fragile states, they need a huge amounts of money. What can the World Bank do to help them access this private capital that's just awash around the world?
So you know, you're completely right. And I wanted to mention that also. Many companies, but also especially the SMEs in FCV settings. Let's not forget that 80% of jobs in FCV settings are coming from the informal sector. So many micro, small, medium enterprise are very vulnerable to COVID-19, to those shocks. And we have a sister organization that you know well, which is our private sector arm called the International Finance Corporation, IFC, which is also implementing the $8 billion fast track financing facility, which basically aims to keep companies in business and preserve jobs. Because, you know, it's not only a question of creating jobs in FCV settings, it's actually, job is very important in terms of bringing stability in many places. So already today, it was about 2 weeks ago, close to 300 clients, private clients have requested support. In fact, the facility may be oversubscribed. So we have been also not only looking at the public side, but also with IFC and with MIGA through the insurance mechanism, trying to see how can we make sure that we provide support, especially to SMEs, and also preserve jobs during this crisis.
Good. Okay, now as you mentioned a few times, in addition to COVID, these fragile states are suffering from a whole host of other problems, which is why they're fragile. High unemployment, poor human development outcomes, corruption, and I know the World Bank has been actively working on those areas. How is that effort affected by the COVID crisis? Is there a danger that we might lose sight of some of those other activities in trying to help these countries with the COVID, or will they mutually reinforce each other?
Well, I think COVID-19 is making it worse, to be very clear. So, you know, in addition to addressing the impact of COVID-19, like you implied, it's very crucial to sustain support over the long term. And what I say is actually to keep the overall FCD agenda on track. Forced displacement, Shanta, used to be an issue a year ago. It's actually getting worse. Those populations are targeted. It's very difficult. in this time of COVID-19 for governments to be providing global public good and to provide as hosting countries even more support to refugees. This is, by the way, why exceptionally we have released $1 billion of grant under our refugee window for those countries, because we know there are some feeling of xenophobia, and therefore in this time of crisis, you need to be even more generous with more concessional funding. But obviously, forced displacement, I was saying, used to be an issue. Today, it's actually getting worse. The same for gender-based violence used to be an issue in many FCV settings. Today, it's actually even worse because of the confinement measures, and I could go along on these aspects. And at the end of the day, many of the issues that for us are critical, which is about prevention, addressing forced displacement, making sure that we are looking at the different drivers of fragilities, are actually just being exacerbated by the current crisis. So our approach consists in twofold. One way is actually to ensure that in our COVID-19 response, we put special focus in those countries impacted by fragility, conflict, and violence, but to do it in a way that will not exacerbate tension, in a way that will allow government to build on some source of resilience, as we have discussed, in a way that will leverage other organizations, in a way of responding to many aspects of the strategy that we just released. At the same time, is to realize that we still need funding and we still need to prioritize many issues that have nothing to do with COVID. In fact, that are getting worse, as I just mentioned, forced displacement or gender. And therefore, we still focus on prevention. We still focus on looking how government can scale up financing to communities that have not felt the state for many years and that are actually turning to other non-state actors, meaning extremist groups. Situation today is actually worse than what it used to be a year ago. And this is part of the overall IDA-19 package that we put together that more or less is representing about $25 billion to address those priorities that are extremely important. So you are completely right. We need to be very careful to remain on the agenda of the FCV, while at the same time responding to this crisis. And that's quite challenging. But it means also that we have to leverage more than at any time other organizations, including those that are more on the security, peace building, humanitarian side, that today more than ever represent some comparative advantage. I was mentioning the presence on the ground, but it's not only that, it's the proximity with communities that nobody can approach. It's also the understanding that the design of the intervention is as important as the financing. Because again, you don't want to exacerbate some current grievances, which could be catastrophic in terms of creation of instability, but you want to take advantage of the crisis to try to build trust vis-a-vis communities that have actually not seen the state for the past 2, 3, 4 years. And that's why we're working very closely with many colleagues in operation across our 6 regions to really have more a tailored approach. It's not only about financing, it's also about the how to in those settings.
And also there are a couple of things like you mentioned in Mali, where you had already started working on distance learning and using ICT for education, whose importance has just gotten even greater when the kids are out of school. So now you can accelerate that. And indeed, it might be useful even after the COVID crisis for the education of the children.
No, completely. And that's the whole point about, and I think it's important for students to say, do not look only at the drivers of fragility, but what are the current source of resilience that needs to be further leveraged. And I think this is also a way of, leveraging more the capacity of the state rather than building ring-fence system that at the end of the day are not adding much after 5 or 10 years. So we need to be very careful again about how we design operation. In the Sahel, the bank is one of the biggest financiers. We are actually not only providing support in Mali, Burkina Faso, Niger, but trying to see also the spillover of the Sahel, trying to see what's happening in Benin, in Togo, in Cote d'Ivoire. So again, the focus over the past years has been more on the prevention side and trying to see about how we can be more proactive in terms of addressing the spillover of crisis to other countries. You knew very well from your time in MENA that we've been focusing on the impact of the Syrian crisis in Jordan, Lebanon. We are doing the same today in Colombia. And by the way, Colombia is not classified as fragile countries. So the whole point of the strategy is actually not to being limited to those poorest countries, but it's to look at the whole fragility, conflict, and violence, including in middle-income countries. We have to know that the number of conflict and death has significantly increased more in middle income countries than in low middle income countries. And therefore discussing what's happening in Philippines, in Thailand, in many other countries is as important than just focusing on those countries that we have been discussing.
And there may be some high income countries that you should start focusing on too, that are becoming increasingly fragile. Okay, let me end, and thanks. That's one last question, Franck. And that is to maybe look ahead. So let's assume that 5 years from now, the COVID pandemic has been solved one way or the other. What do you see is the state of fragility, fragile states 5 years from now? Will there be more fragile states, fewer fragile states? Will there be a difference? Will we see some differences in the way fragility reveals itself and development in general?
Well, Shanta, I don't have the crystal ball, and I think, if I may, it's going to depend a lot on a few factors. So first, on the impact itself of COVID-19 for all the students, our view is very clear, that those countries that are already impacted by fragility, conflict, and violence are going to be severely impacted by the unfolding COVID-19 health and economic crisis has. It's not only about, again, the number of cases or the number of people that are going to die. You saw my emphasis on the secondary impact, which are much more important. How many people will not be able to get immunization program vis-a-vis other disease? Let's not forget that if you look at the Human Capital Index, the countries that are at the bottom are precisely those 14 countries that are classified as fragile. All those countries we know are going to face significant human development issue, education, health, and it's not only just about COVID-19. You heard me about the impact on remittances, the impact on the economic front, the recession, but also about the fact that some pocket of instability are going to be significantly increased with the emergence of new extremisms in area where the state is quite absent. So for me, I would like just to say that we do believe that social unrest, conflict, violence, but also this notion of compound risk, looking at the impact on food security, for instance, need to be monitored in real time. And we could definitely see an increased fragility, at least over the short, medium term. Does it mean more countries joining this list of fragile situations? Maybe yes, but also it means that within those countries, what I'm concerned is that many groups, especially those very marginalized, we're talking about women, young, also talking about refugees, IDPs, I didn't mention IDPs, which is very important, could actually really suffer. And it's very difficult to get the numbers, as you know, but obviously we know by looking at some countries, it's already happening. So at the end of the day, I think the level of fragility could be increased over the next few years, but it's going to depend a lot on two things. First, on the support that the international community will provide. We know there is a major crisis that is severely impacting those countries which are in deep recessions. How much support is going to be provided? Second point is about the nature of the response of government. As I mentioned, in some case, some countries could be actually taking advantage of those crises to build back better. And as you mentioned, Shanta, trying to finally boost internet capacity, provide more support through e-learning, and also try to address some grievances that were existing before COVID-19. And that's what I would call building back better. In other cases, we may see actually an aggravation of the situation and actually trying to see that some communities felt completely forgotten in the response of the states, even if it's just a perception, and therefore creating more grievances than before, more instability. So at the end of the day, there are many factors that will come to play. We may get the real number in a few years. That's why in response to your first questions, I say, you know, it's maybe too early to make a judgment call. I do believe, however, that we may see growth rate increasing by the day, as we have seen over the past month. And that's something where we need to be very careful. But it's very difficult otherwise to go beyond.
Yeah, just one follow-up question quickly. You mentioned international cooperation. And this is something, you know, we've been relying on, and it's been absolutely essential for fragile countries, is to have the more stable, richer countries actually cooperate in trying to help them. But now with COVID, those stable, richer countries are also facing the pandemic and a global recession and major recessions. So what are the prospects for international cooperation in dealing with fragile states?
So I think, it's more than ever, I think it's important to realize the notion of global public good. Investment in fragile states is actually more important than ever. It was important before COVID-19, but we know that today, if you look at the number of poor worldwide, we know that because of COVID-19, we are going to have an increase of poverty by about 18 million this year. 18 million people additional will be in FCV settings this year because of COVID-19. And we all share the SDGs. We all want to reduce poverty, and we all know that poverty is more and more concentrated in those countries. In fact, by 2030, our projection shows that about 2/3, 65, 68% of the extreme poor will be in those countries. So I think today more than ever is the importance to have an international coalition that is going to invest in those countries to try at least to preserve development gains over the past few years. Obviously, those countries that have the funds are also those countries that are being impacted, and therefore it's very difficult to make to decide to be even more generous. But obviously, this is going to impact and respond to your last questions about how do you see the level of fragility over the next few years.
Mm-hmm. Mm-hmm. Okay. Well, this has been great. Thank you so much, Franck Bousquet, for joining us, and always a pleasure to talk to you.
Two fascinating conversations about the challenges that fragile states are facing because of the COVID pandemic. Let me highlight several points coming out of those two interviews. First, the impact of COVID on the existing challenges, which are significant in fragile states: corruption, high unemployment, health challenges, gender-based violence, and a range of other issues. And the importance of keeping these other agendas on track as resources and attention are diverted from these issues to COVID-19, and how we can continue to support fragile states on making progress on these issues in the time of pandemic. Second is the importance of partnerships, the importance of bringing in a wide range of partners to leverage their presence in hard to reach areas and difficult conflict areas, and to leverage their financing to help fragile states. And that's an area which we will be watching closely, as how these partners are coming together during the pandemic. And lastly, what technological advances are possible. Many fragile states have been lagging behind in their technological developments, but we are also seeing opportunities, as was flagged by in the interviews, of the opportunity to have countries leapfrog technological developments in this time of COVID. We're looking for those opportunities that COVID presents that would not have normally been there. We have many challenges ahead when looking at fragile states during this time of the pandemic. We hope you'll have a productive and fruitful conversation about these issues.